Hi, Brenda with the Hospice Care Plan. Grief is a necessary, unavoidable, and even healthy part of death. And when we are having those intense grief experiences and emotions before our loved one has died, that's called anticipatory grief. And it's the body and the soul's way of preparing and protecting ourselves for the upcoming death. And then once our loved one has died, grief takes a different form. And it's the loneliness, the reality of it all sets in. And it can be it's very different for everybody, and it can be very intense. There isn't a timeline on it. And what's important is that we try and lean in to that grief. Research shows when we have a very intense emotion, if we just let that emotion be, it really only lasts about 90 seconds. And I really think of grief as comes in waves. Sometimes they're small little waves that catch us by surprise, and sometimes they feel like they're tsunamis that we're not going to catch our breath. I often refer to this Chinese proverb, which I can never remember, so I'm going to read to you to say it correctly. Suppression leads to momentary relief and permanent pain. Feeling or experience leads to momentary pain and permanent relief. I think that kind of sums it up. And I think that even when we're not okay in these intense emotions that we're having after our loved one has died, trust that you're going to get there. Breathe through it. Try and lean into it as much as you can. And if it's intolerable, pull away. But just practice that. Know that it's going to come. Expect it. And over time, it morphs into a form of healing. I think what's important is to get help and support when you feel stuck in your grief process. It can be a public thing. It can be a private thing. And we all express it differently. You just Google in your local area grief support groups, or call your local hospice, and they can guide you to a grief support group. Our social workers on hospice are trained at grief counseling, and most hospices have a grief support group. So as hard as it is, take that breath and lean into your grief if you can.